This is Nursing Uncensored. Your host, Adrianne Benning, invites you to listen in on real conversations about all things in the nursing world. This podcast is intended for nurses, nursing students, and allied health professionals, but non-medical folk will probably get a kick out of us too. If you like what you hear, subscribe and share. Hey, welcome back, guys. This is Adrianne here with part 3 of my must-have iOS apps for nurses and nursing students. This is the last installment of this series. We're getting to the end of my long list of nursing apps. I have 9 more for you today. Some of these are kind of a miscellaneous grouping, but some of these actually are really useful, so let's go ahead and dig in. Number 1, I have my Stethoscope app. It's just called Stethoscope. And this one's interesting because it has a few different things. It has lung, heart, and bowel sound guides. So you actually have like a sound library, so you can go in and listen and brush up on lung sounds. So I know I've talked to a lot of newer nurses who say like, I'm not good at hearing lung sounds. Well, this app is a great way to brush up, or even on the fly, if you're hearing something, you can't quite place what it is. This is a good reference. The list, for example, of lung sounds, it has a text description of what the sound is, and then a little sound wave. All right, let's see if we can hear this. Let's see if we can get this moderate wheeze to play. So that's a wheeze, you guys. So this is great. There's the same for heart sounds and bowel sounds. Also, interesting, I don't know that I would use this on a patient for infection control reasons, but it actually has a stethoscope function to it. So if you open up the stethoscope function, you have to have headphones connected. So either Bluetooth if your headphone jack is on the same side as your mic, or if it's not, you can just plug in regular headphones. And then you can literally place the microphone of your phone on your chest, and you can actually hear pretty damn well. You can hear, and you can also record it with the paid version of this app. Again, I wouldn't be like assessing patients with this, because then you're putting your phone on the chest of multiple patients, and that's kind of gross. But say you want to just practice listening to people, like your friends, your family, yourself, this is a great way to do that, and it's just kind of cool. All right, to a similar thread, but not exactly, I have my Echo app on here. So I bought, if those of you who may know from looking at other posts, I bought an Echo device that connects between the head of my stethoscope and the tubing that leads up to my earpieces. So this essentially takes my manual stethoscope and turns it into a digital stethoscope, and I can amplify the volume. Not only can I amplify the volume, but I can open up my app. I can see the person's heart rate on my phone. I can see their EKG, and I can also, tell the app where on the body that I'm listening, so it can help me figure out what I'm hearing. This is great. The app is HIPAA compliant, although you still have to be aware of your hospital or institution's policies and procedures. They may not want you to use something like this because it could bring into question whether or not you're recording people's body sounds. But if you are in a practice that actually uses this, this would be great for sending information to the patient chart or to another physician or whatever the case may be. So just know what your privacy policies are. Number 3, I have my Castle Branch app. So I don't know how widely this is used. I've used it at multiple schools that I've attended, but Castle Branch is essentially a company that manages all of your documents. So for me, my schools, for a fee, use this service so that they can keep track of all of my compliance documents in one place. Everything from background checks to vaccinations, insurance, that sort of thing. So this is like the one-stop shop. I upload everything here, and there it sits for any company or school that needs access to it. So that's the Castle Branch app. I have number 4 on here. I have another Palliative Care app. I put this on here just because this is just another great resource for people who are not just end of life, but also are undergoing symptom management. One example is I've taken care of patients who are receiving radiation and chemo, but they have intractable nausea. And so they're on the palliative service because even though they are still receiving hopefully life-saving treatment, they need something more than what a normal physician or oncology doc would be able to do. So we can do some things a little differently with medication and other treatments that make us a wonderful service. With that in mind, you need to be educated about what these things are. So looking at the main menu for this app, there are categories like pain management, nausea and vomiting, intestinal instruction, breathlessness, delirium, lymphedema, mouth care, last days of life, so on and so forth. So this is a really great resource as well. You can save bookmarks and search by topic as well. Number 5, I have my NurseGrid app. I love this app, and ordinarily it's not in this folder with all my other apps. It's usually on the very front page of my iPhone, and this is my scheduling app. This I love for a few different reasons. Even though I use Google Calendar for all my scheduling, I can plug my schedule very, very easily into this app, and it feeds into my Google Calendar without me having to duplicate those entries. The reason I like it is because I can tell the app, okay, well, I work straight nights, and so my shifts are always going to be from 1900 to 0730. So I can go in and say I want to add, got my new schedule, I want to put in the next 6 weeks of shifts I'm working, hit the plus sign, and I can just go through the calendar and just tap, 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 tap the dates that I want to put my shifts in, and I don't have to worry about putting in the time and did I put the right dates in and do the days overlap properly. Don't have to worry about any of that. The other nice thing is there's a number of people that I work with that also use this app, so I can look and see without logging on to my hospital scheduling system. I can say, oh, these people are on shift with me tonight. Cool. There's also the option to offer to swap shifts on this app, but my hospital doesn't use that because we have to make all of our requests through our managers in our scheduling system. But this is a pretty great app because if people are ever like, hey, when do you work again? I can just take a screenshot of my calendar and send it to them. And all it is my work schedule. So that's pretty cool. All right, number 6. In my episode with Nurse Lo a few weeks ago, I talked about how I had a moon cycle app on my phone, and I really do. It's called Moon Plus. I have the free version, so it has ads and stuff, but it tells me how close we are to a full moon. And anyone that's worked with the elderly or populations that are susceptible to delirium, you really want to know, because I keep saying this. I need to do a lit search or something because I am certain in my bones that the moon just messes with people. So I like to know when it's a full moon. I try not to schedule myself for those days, and if I am scheduled for one of those days, well, I want to know so I can brace myself. So that's my moon phase app, Moon Plus. All right, the next one I think I also talked about when I talked to Nurse Lo, but it's the AHRQ ePSS. What? This is basically the U.S. Preventative Services database, and if you go into this app, you are given a series of boxes that you can fill out, and it helps you determine what preventative medical care or treatments or tests or whatever are recommended for a person with these particular demographics. So I can say I am 37 years old, I am female, I am not pregnant. Was I ever a tobacco user? Yes, I was. Sexually active? We'll say sure. And then you hit start, and it tells me all of the things that are recommended that I be doing for preventative health. Cervical cancer screening, folic acid if I want to be pregnant, HIV screening, blood pressure, syphilis, tobacco smoking cessation, alcohol misuse. Do I have the BRCA gene, the BRCA gene to increase my cancer risk? Am I breastfeeding? Do I need chlamydia, depression, gonorrhea screenings, hepatitis? I mean, the list goes on and on. If I were to back it up and say, let's say I'm a 58-year-old male. Yes, I use tobacco. No, I'm not sexually active. Then it says, okay, you need colorectal cancer screening, HIV, high blood pressure, smoking, alcohol, aspirin use to prevent heart attack, all these different things. So it essentially tells you what you need. Here, let's see. That's one more thing. So I know that when I was doing my OB peds, keeping vaccinations straight was crazy, so hard. So I'm going to say 9-year-old female, not pregnant, never used tobacco, not sexually active. So there are no Class A recommendations, but other screenings are obesity, skin cancer prevention, looking at celiac disease, depression, drug use, lipid disorder, that sort of thing. So this is great. Let's use this if we need to figure out who's at risk for what. All right, second to last one, we've got number 8 here. This one is less about science and more about you. So I just opened up my Calm app. We can hear water rushing, birds chirping. This is just the home screen. I'm relaxed already. Okay, I'm going to turn the volume down here because I don't know how good that sounds to you. But essentially, this has, there is a premium version of this that probably allows you to do a lot more without ads. But I can choose to set sleep tones. I can choose a brief meditation. It allows you to select a number of different, do I want to do mindful eating? Do I want to do breathing exercises? Mindfulness at work? Deep stress management. There's all these little different things. Some of them are locked, some of them are free, but it is that tool that will allow you to actually take, like say you've got a 5-minute break. Spend 2 minutes of it just closing your eyes, doing deep breathing, calming yourself down, making sure that you're not frantic when you step back out on the unit. I really like this. I use this when I can. Sometimes even if it's only like 30 seconds in the bathroom, I'm gonna listen to those fucking birds tweet until I feel good again. So that's just one to keep in your back pocket just in case for those days when you think you're gonna lose your mind. Oh, last but not least on this list, this one also, I could say this goes for any student of any discipline. This is a valuable app. Not only the app, but the online version. You guys, you all want Khan Academy. A lot of you have heard of this already. If you've made it all the way into nursing classes, you've probably been in school for a little while. Maybe Khan Academy is something you're already familiar with. If not, it is a gold mine, a fucking gold mine for anyone who is struggling with any topic. I have used Khan Academy videos for help with math, chemistry, what else? All sorts of different anatomy pathos. Khan Academy has saved my ass when I just wasn't getting a topic. So it's essentially a massive organization that has a huge database of topics. So under the science category, I have lectures for you for, well, no, I don't have them for you. Khan Academy has lectures on physics, chemistry, AP chemistry, organic chem, bio, AP bio, high school bio, I thought that said cosmetology, cosmology and astronomy. Not that cosmetology isn't important. Health and medicine, there's like economics, art and humanities, computers, test prep, TED Talks, college planning. Everything is on Khan Academy. I love this app and I encourage all of you to download it and then go online and find Khan Academy on YouTube or their website or wherever. Because I will tell you, I feel like more than anything else in nursing school, YouTube and Khan Academy by way of YouTube gave me such a better grasp on content that was either confusing from reading the book, or I had a lecturer that maybe I didn't like their style, or they didn't really spark that information in my brain. But anyway, I'm not going to get too rambly. Khan Academy is golden. All right, guys. Well, That's it. That was part 3 of my 3-part series on must-have iOS apps for nurses and nursing students. I hope that of these 27 apps that there are some that will help you on your journey, whether it be in school or in your profession. What did I miss, guys? Are there apps that you love? I would love to hear from you. You can email me, send me a message on social media, or comment at nursinguncensored.com. I love hearing from you guys, and I love seeing that you're downloading these episodes. So, with all that said, happy nursing, folks, and happy studying, too. Here at Nursing Uncensored, we may be, well, uncensored, but we're not unfiltered. Protected health information has been changed and concealed to comply with HIPAA. The things we talk about are from years of experience with thousands of patients, things we've read, stories we've heard. If you think we're talking about you, we're not. Also, we're real nurses here to provide helpful and accurate information, but don't take anything we say as fact without doing your own research. Refer to your state's Board of Nursing, Practice Acts, and your institution's policies and procedures if you have questions about your practice. Lastly, our very strong opinions are ours alone and do not reflect those of our employers, educational, or professional institutions. Thanks for listening, and happy nursing, folks.